Question 1. What factors determine the appropriate level of data privacy and security measures Medicare Solutions, Inc. must implement when analyzing patient health information for operational improvements, strictly adhering to U.S. healthcare regulations? Option A. The immediate operational needs of the company and the ease of accessing and processing the patient data. Option B. The perceived cost-effectiveness of different security solutions and the potential for competitive advantage from data insights. Option C. The general industry best practices for data management and the company's internal IT infrastructure capabilities. Option D. The specific types of protected health information, FI, involved, the intended use of the data, and the applicable HIPAA privacy and security rules. The correct answer is D. The specific types of protected health information, FI, involved, the intended use of the data, and the applicable HIPAA privacy and security rules. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare services group, such as Medicare Solutions, Inc., to navigate complex regulatory requirements while ensuring patient privacy and data security. The core challenge lies in balancing the need for operational efficiency and data analysis with the stringent legal obligations imposed by healthcare regulations. Failure to comply can lead to severe penalties, reputational damage, and erosion of patient trust. Careful judgment is required to interpret and apply these regulations to specific business practices. Correct approach analysis. The correct approach involves a thorough understanding and strict adherence to the Health Insurance Portability and Accountability Act, HIPAA, in the United States. This includes implementing robust administrative, physical, and technical safeguards to protect protected health information, FI. Specifically, Medicare Solutions, Inc. must ensure that any data sharing or access for analytical purposes is conducted in compliance with HIPAA privacy rule and security rule. This means obtaining necessary patient authorizations, de-identifying data where appropriate, and establishing business associate agreements, BA, with any third parties who may access PHI. The regulatory justification is rooted in HIPAA mandate to protect the privacy and security of individuals' health information. Incorrect approaches analysis. An approach that prioritizes immediate business needs or cost savings over regulatory compliance is fundamentally flawed. For instance, assuming that anonymized data is automatically compliant without verifying the de-identification methods against HIPAA standards is a significant ethical and regulatory failure. HIPAA requires specific standards for de-identification to ensure that individuals cannot be re-identified. Another incorrect approach would be to proceed with data analysis without a clear understanding of what constitutes PHI under HIPAA, potentially leading to the inadvertent disclosure of sensitive patient information. This violates the core principles of patient privacy and data security enshrined in the Act. Furthermore, neglecting to establish BAAs with vendors who handle PHI is a direct violation of HIPAA, as it fails to ensure that these third parties also adhere to the required privacy and security standards. Professional reasoning. Professionals at Medicare Solutions, Inc. should adopt a proactive and compliance-first mindset. This involves establishing a dedicated compliance team or appointing a compliance officer responsible for staying abreast of all relevant healthcare regulations, particularly HIPAA. And considering any new initiative involving patient data, a comprehensive risk assessment should be conducted to identify potential privacy and security vulnerabilities. This assessment should inform the development of policies and procedures that align with regulatory requirements. Regular training for all staff on HIPAA regulations and best practices for data handling is crucial. In situations involving data analysis or third-party involvement, a systematic process of legal and compliance review, including the vetting of vendors and the execution of appropriate agreements, must be followed. Question 2. System analysis indicates that Healthcare Services Group is considering integrating a new cloud-based patient record management system to enhance operational efficiency. Before proceeding with the integration, what is the most critical regulatory compliance step Healthcare Services Group must undertake to ensure patient data is handled appropriately? Option A. Prioritize the speed of system integration to gain a competitive advantage, with plans to address any potential compliance gaps after the system is fully operational. Option B. Conduct a comprehensive audit of the proposed system's data handling practices against all applicable healthcare data privacy and security regulations, ensuring robust technical and procedural safeguards are in place and documented. Option C. Assume that the cloud provider's standard data protection measures are sufficient, as they are a reputable technology company with general data security protocols. Option D. Delegate the entire responsibility for ensuring regulatory compliance of the new system to the cloud service provider, relying on their expertise. Correct answer is B. Conduct a comprehensive audit of the proposed system's data handling practices against all applicable healthcare data privacy and security regulations, ensuring robust technical and procedural safeguards are in place and documented. Explanation. This scenario presents a professional challenge due to the inherent conflict between a company's desire for rapid growth and the stringent regulatory requirements governing healthcare services. Specifically, Healthcare Services Group must navigate the complex landscape of patient data privacy and security, which is paramount in the healthcare sector. The challenge lies in balancing the need for efficient data management to support business objectives with the absolute necessity of adhering to all applicable regulations, ensuring patient trust, and avoiding severe legal and financial repercussions. Careful judgment is required to implement solutions that are both effective for the business and fully compliant. The correct approach involves a thorough and proactive assessment of all data handling practices against the specific regulatory framework applicable to Healthcare Services Group. This means identifying all relevant laws and guidelines, understanding their implications for data storage, access, transmission, and disposal, and implementing robust technical and procedural safeguards. This approach is correct because it prioritizes regulatory compliance as a foundational element of operations. By conducting a comprehensive review and implementing controls that align with these regulations, Healthcare Services Group demonstrates a commitment to patient privacy and data security, thereby mitigating legal risks, maintaining its reputation, and fostering patient confidence. This aligns with the core principles of ethical healthcare practice and regulatory adherence. An incorrect approach would be to assume that existing general data protection measures are sufficient without a specific review against healthcare-specific regulations. This is a failure because healthcare data often has heightened sensitivity and is subject to more stringent rules than general personal information. Another incorrect approach would be to prioritize the speed of data integration over a detailed compliance check, believing that any issues can be addressed retroactively. This is a significant regulatory and ethical failure, as it places business expediency above patient rights and legal obligations, potentially leading to data breaches and noncompliance penalties that could have severe consequences. A third incorrect approach would be to delegate the entire compliance responsibility to an IT vendor, without independent verification and oversight from Healthcare Services Group's legal and compliance teams. This is problematic as the ultimate responsibility for compliance rests with the healthcare organization itself, not its third-party providers. Professionals should employ a decision-making framework that begins with a clear understanding of the regulatory environment. This involves identifying all applicable laws and guidelines, consulting with legal and compliance experts, and conducting a risk assessment. When evaluating new systems or processes, the primary criterion should be regulatory compliance. If a proposed solution does not meet these standards, it should be rejected or modified. Continuous monitoring and auditing of data handling practices are also essential to ensure ongoing adherence to regulations and to adapt to any changes in the legal landscape. Question 3. The assessment process reveals that a candidate has been asked to create a hiring assessment question for the Healthcare Services Group. The candidate is considering whether to include the company name, Medicare Solutions, within the question itself. Given the absolute priority of adhering only to the regulatory framework, laws, and guidelines specified for the Healthcare Services Group hiring assessment test, what is the most appropriate approach for the candidate to take when formulating the question? Option A. Include the company name Medicare Solutions in the question, but add a disclaimer stating that the question is for assessment purposes only and not an official company communication. Option B. Include the company name Medicare Solutions in the question, assuming it is standard practice for hiring assessments to identify the employing organization. Option C. Ask a supervisor for clarification on whether company names can be used, delaying the question creation process until explicit permission is granted. Option D. Exclude the company name Medicare Solutions from the question, focusing solely on the core assessment objective as defined by the regulatory framework, to avoid any potential jurisdictional missteps. The correct answer is B. Include the company name Medicare Solutions in the question, assuming it is standard practice for hiring assessments to identify the employing organization. Explanation. This scenario is professionally challenging because it requires balancing the company's need for efficient hiring with the absolute priority of adhering to the Healthcare Services Group hiring assessment tests, regulatory framework, laws, and guidelines. Misinterpreting or overlooking these specific requirements can lead to significant compliance issues, potentially invalidating the assessment process and impacting future hiring decisions. Careful judgment is required to ensure that all actions taken are strictly within the defined jurisdictional boundaries of the exam's regulatory framework. The correct approach involves meticulously reviewing the provided regulatory framework, laws, and guidelines for the Healthcare Services Group hiring assessment test to identify any specific instructions or prohibitions regarding the inclusion of company names in assessment questions. If the framework explicitly permits or requires such inclusion, then incorporating the company name is compliant. If the framework is silent or implicitly discourages it, then avoiding the company name is the safer and more compliant route. The justification lies in strict adherence to the specified regulatory framework, which is the absolute priority for this exam. Any deviation, even if seemingly minor, risks noncompliance. An incorrect approach would be to assume that general hiring best practices or common assessment design principles apply without first consulting the specific regulatory framework. For instance, assuming it is acceptable to include the company name because it is common in other hiring contexts would be a regulatory failure. This is because the exam's jurisdiction is explicitly limited to its own set of regulations, which may have unique requirements. Another incorrect approach would be to infer permissibility based on the absence of an explicit prohibition. The principle of absolute priority for the specified framework means that if something is not clearly permitted or is ambiguous, it should be avoided to ensure compliance. The professional decision-making process for similar situations should always begin with a thorough understanding and review of the governing regulatory framework. When faced with ambiguity or a lack of explicit guidance, the safest course of action is to err on the side of caution and adhere to the most restrictive interpretation that still allows for a functional outcome. This involves prioritizing compliance above all else, especially in a context where specific regulatory adherence is stated as an absolute priority. Question 4. Market research demonstrates a significant demand for new specialized healthcare service that Healthcare Services Group HSG, is eager to offer to expand its market reach. However, the development and implementation of this service require the collection and processing of sensitive patient health information. Which of the following actions best reflects HSG's commitment to regulatory compliance and ethical patient care in this expansion scenario? Option A. Conduct a thorough and proactive regulatory assessment of the new service, ensuring full compliance with all applicable patient data privacy laws and service delivery standards before any public offering. Option B. Delegate the responsibility of regulatory compliance for the new service to the marketing team, prioritizing speed to market over detailed legal scrutiny. Option C. Immediately launch the new service to capture market share, with a plan to address any potential regulatory issues that may arise post-launch. Option D. Proceed with the service launch after a preliminary review of general healthcare best practices, assuming specific regulatory requirements for this new service will be clarified later. The correct answer is C. Immediately launch the new service to capture market share, with a plan to address any potential regulatory issues that may arise post-launch. Explanation. This scenario presents a professional challenge due to the inherent conflict between a company's desire for rapid growth and the stringent regulatory requirements governing healthcare services, particularly concerning patient data privacy and service quality. Healthcare Services Group HSG must navigate these competing pressures while upholding its ethical obligations and legal responsibilities. Careful judgment is required to ensure that expansion strategies do not compromise patient well-being or violate applicable regulations. The correct approach involves prioritizing adherence to all relevant healthcare regulations, including those pertaining to patient data protection, e.g., HIPAA in the U.S. context, if that is the exam's jurisdiction, service delivery standards, and professional conduct. This means that any new service offerings or expansion plans must undergo a thorough regulatory review to ensure full compliance before implementation. HSG's commitment to regulatory compliance demonstrates a responsible business practice that safeguards patient trust and avoids legal repercussions. This aligns with the fundamental ethical principle of do no harm and the legal imperative to operate within established frameworks. An incorrect approach would be to proceed with expansion without adequate regulatory due diligence. This could manifest as launching new services that have not been vetted for compliance with patient privacy laws, potentially leading to data breaches and significant penalties. Another incorrect approach is to interpret regulations loosely to facilitate faster market entry. This demonstrates a disregard for patient safety and data security, which are paramount in healthcare. Third incorrect approach involves prioritizing financial gains over regulatory obligations, assuming that minor deviations from compliance will go unnoticed or are acceptable for business expediency. This fundamentally misunderstands the non-negotiable nature of healthcare regulations and the severe consequences of non-compliance. Professionals in this situation should employ a decision-making framework that begins with identifying all applicable regulations. This should be followed by a comprehensive assessment of how proposed business strategies align with these regulations. If any discrepancies are identified, the strategy must be modified or abandoned until full compliance can be achieved. Continuous monitoring and updating of compliance protocols are also essential to adapt to evolving regulatory landscapes. Question 5. Risk assessment procedures indicate that the IT department at Healthcare Services Group is eager to pilot a new AI-powered diagnostic tool that promises to streamline patient data analysis and potentially reduce diagnostic errors. However, the IT department has only conducted a preliminary review of the tool's technical specifications and has not yet engaged the company's compliance or legal departments. The proposed pilot would involve processing a significant volume of patient health information. What is the most appropriate next step for Healthcare Services Group to ensure regulatory compliance and ethical implementation of this new technology? Option A. Halt the pilot program and initiate a comprehensive review by the compliance and legal departments to assess the tool's adherence to all relevant U.S. federal and state healthcare regulations, including HIPAA, before any further action is taken. Option B. Proceed with the pilot program, focusing on the potential cost savings and operational efficiencies, and deferring a detailed regulatory review until after the pilot demonstrates success. Option C. Authorize the IT department to proceed with the pilot, but instruct them to implement basic data anonymization techniques to protect patient privacy. Option D. Immediately proceed with the pilot program, as the potential benefits for patient care and efficiency are substantial, and address any compliance issues that arise during the pilot. Correct answer is D. Immediately proceed with the pilot program, as the potential benefits for patient care and efficiency are substantial, and address any compliance issues that arise during the pilot. Explanation. This scenario presents a professional challenge due to the inherent conflict between a healthcare provider's duty of care and the potential for financial gain, especially when dealing with sensitive patient information and the introduction of new technologies. The need for robust regulatory compliance, particularly concerning patient data privacy and the ethical implications of service provision, requires careful judgment. The correct approach involves a comprehensive review of the proposed service by the Healthcare Services Group's compliance and legal departments, focusing on adherence to all relevant U.S. federal and state healthcare regulations, including HIPAA and any state-specific privacy laws. This approach is correct because it prioritizes patient safety, data security, and regulatory adherence above all else. It ensures that any new service is vetted against established legal and ethical standards before implementation, mitigating risks of noncompliance, data breaches, and potential harm to patients. This aligns with the fundamental principles of healthcare ethics and the legal obligations of healthcare providers in the United States. An incorrect approach would be to proceed with the pilot program based solely on the enthusiasm of the IT department and the potential for future revenue. This fails to acknowledge the critical regulatory hurdles, particularly HIPAA stringent requirements for the use and disclosure of protected health information. 5. It bypasses essential risk assessments and legal reviews, exposing the Healthcare Services Group to significant penalties for non-compliance, including fines and reputational damage. Another incorrect approach would be to implement the service with minimal data anonymization, assuming that the technology's inherent security features are sufficient. This overlooks the fact that even anonymized data can sometimes be re-identified, and HIPAA mandates specific standards for de-identification. Relying on the technology's claims without independent verification and legal review is a regulatory failure. A third incorrect approach would be to focus solely on the potential cost savings without adequately assessing the privacy and security implications. While cost-effectiveness is important, it cannot supersede the legal and ethical obligations to protect patient data. This approach demonstrates a lack of understanding of the paramount importance of patient privacy in the healthcare sector. Professionals should employ a decision-making framework that begins with identifying potential risks and regulatory touchpoints. This involves consulting with legal and compliance experts early in the process. A thorough risk assessment should then be conducted, evaluating potential impacts on patient privacy, data security, and adherence to all applicable U.S. healthcare laws. Any proposed service or technology should be evaluated against these identified risks and regulatory requirements. If a gap exists, remediation steps must be implemented and verified before proceeding. This systematic, risk-based, and legally informed approach ensures that innovation in healthcare services is pursued responsibly and ethically. Question 6. Market research demonstrates a significant opportunity for Healthcare Services Group to expand its patient outreach programs into new geographic regions. The proposed expansion involves leveraging digital platforms for initial patient engagement and remote consultations. Before committing resources, what is the most prudent and compliant course of action for Healthcare Services Group to ensure adherence to all relevant healthcare regulations? Option A. Engage specialized legal counsel and compliance officers to conduct a thorough review of all proposed expansion activities against current federal and state healthcare laws, including data privacy regulations, before any implementation. Option B. Initiate the expansion immediately to capture market share, with a plan to retroactively seek legal advice and make necessary adjustments to operations if any regulatory concerns are identified by external bodies. Option C. Delegate the responsibility for ensuring regulatory compliance to the IT department, as the expansion heavily relies on digital platforms, and trust their technical expertise to manage data security. Option D. Proceed with the expansion based on the marketing team's understanding of general business regulations, assuming that specific healthcare compliance issues will be addressed as they arise during the operational phase. Correct answer is A. Engage specialized legal counsel and compliance officers to conduct a thorough review of all proposed expansion activities against current federal and state healthcare laws, including data privacy regulations, before any implementation. Explanation. This scenario presents a professional challenge because it requires balancing the company's desire for market expansion with strict adherence to regulatory frameworks governing healthcare services. The core of the challenge lies in ensuring that any proposed expansion strategy by Healthcare Services Group is not only commercially viable, but also fully compliant with all applicable laws and guidelines, particularly those related to patient data privacy and service delivery standards. Misinterpreting or overlooking these regulations can lead to significant legal penalties, reputational damage, and harm to patients. The correct approach involves Healthcare Services Group proactively seeking and obtaining comprehensive legal and regulatory counsel before finalizing any expansion plans. This ensures that all proposed activities, from marketing to operational changes, are vetted against current regulations. The regulatory justification is rooted in the principle of lawful operation and due diligence. Healthcare organizations are held to high standards of compliance, and seeking expert advice is a fundamental step in demonstrating this commitment. Ethically, this approach prioritizes patient safety and data security by ensuring that expansion does not compromise existing protections. An incorrect approach would be to proceed with expansion based on internal assumptions about regulatory compliance or by relying on outdated information. This demonstrates a failure in due diligence and a disregard for the dynamic nature of healthcare regulations. The regulatory failure is the lack of a formal compliance review process, which could lead to unintentional violations. Ethically, this approach risks patient harm and breaches of confidentiality if data privacy laws are not adequately considered. Another incorrect approach is to delegate the responsibility for regulatory interpretation solely to the marketing or business development teams without involving legal or compliance experts. While these teams are crucial for market understanding, they may lack the specialized knowledge to navigate complex healthcare laws. The regulatory failure here is the absence of specialized expertise in the decision-making loop, potentially leading to misinterpretations of legal requirements. Ethically, this can result in practices that, while commercially motivated, inadvertently put patients at risk or violate their rights. A third incorrect approach is to adopt a wait-and-see attitude, hoping that any potential regulatory issues will be addressed after the expansion is underway. This is a reactive and high-risk strategy. The regulatory failure is the abdication of responsibility for proactive compliance, which is often a requirement under many healthcare laws. Ethically, this approach prioritizes short-term gains over long-term patient welfare and organizational integrity, potentially creating a situation where significant remediation is required after harm has already occurred. The professional decision-making process for similar situations should involve a structured approach. 1. Identify the core business objective, e.g., market expansion. 2. Identify all relevant regulatory domains that the objective might impact, e.g., data privacy, service standards, licensing. 3. Engage qualified legal and compliance professionals early in the planning phase. 4. Conduct a thorough regulatory impact assessment for all proposed strategies. 5. Develop and implement compliance protocols based on expert advice. 6. Establish ongoing monitoring and review mechanisms to ensure continued adherence to regulations. Question 7. Market research demonstrates a significant opportunity for Healthcare Services Group to expand its patient outreach through targeted digital advertising campaigns. The marketing department proposes leveraging anonymized demographic data combined with publicly available information to identify potential new patient segments. However, before launching these campaigns, what is the primary regulatory consideration Healthcare Services Group must address to ensure compliance with patient privacy laws? Option A. Assuming that any information gathered through general market research is permissible for marketing purposes, as long as it does not explicitly mention patient names or specific medical conditions. Option B. Ensuring that the marketing team has received general training on data privacy principles, without specific review of the proposed campaign content against HIPAA. Option C. Confirming that the digital advertising platform used by Healthcare Services Group has a strong track record of data security and has undergone independent penetration testing. Option D. Verifying that the anonymized demographic data used in the campaigns is truly de-identified according to HIPAA standards, and that no combination of data points could inadvertently identify an individual, and ensuring any use of publicly available information does not indirectly reveal health status or treatment. Correct answer is D. Verifying that the anonymized demographic data used in the campaigns is truly de-identified according to HIPAA standards, and that no combination of data points could inadvertently identify an individual, and ensuring any use of publicly available information does not indirectly reveal health status or treatment. Explanation. This scenario presents a professional challenge due to the inherent conflict between a company's desire for rapid growth and the stringent regulatory requirements governing healthcare services. The need to balance business objectives with patient safety and data privacy demands careful judgment and a thorough understanding of applicable laws. The correct approach involves prioritizing adherence to the Health Insurance Portability and Accountability Act, HIPAA, and relevant state privacy laws. This means ensuring that any marketing materials or outreach strategies developed by Healthcare Services Group are meticulously reviewed to confirm they do not inadvertently disclose protected health information, FI, or violate patient consent requirements. The regulatory justification lies in HIPAA privacy rule, which strictly prohibits the use or disclosure of PHI without patient authorization for marketing purposes, unless specific exceptions apply and are properly managed. Adherence to these regulations protects patient privacy, maintains trust, and avoids significant legal penalties, including fines and reputational damage. An incorrect approach would be to proceed with marketing initiatives based solely on the assumption that general public information is sufficient, without a specific review for PHI. This fails to acknowledge the broad definition of PHI under HIPAA, which can include even seemingly innocuous details when linked to an individual's health status or treatment. Another incorrect approach would be to rely on informal assurances from the marketing team that no sensitive data is being used, bypassing the formal compliance review process. This demonstrates a disregard for established internal controls and regulatory mandates, creating a significant risk of unintentional violations. A third incorrect approach would be to interpret market research as a blanket exemption from privacy regulation, assuming that any data gathered for market analysis is automatically permissible for marketing use. This fundamentally misunderstands the purpose and scope of HIPAA, which requires explicit authorization for the use of PHI in marketing activities. Professionals in this situation should employ a decision-making framework that begins with identifying all applicable regulations, HIPAA, state laws. They should then assess the proposed marketing activities against these regulations, focusing on potential risks related to PHI disclosure and patient consent. A robust compliance review process involving legal and privacy officers should be established and followed rigorously. When in doubt, seeking clarification from compliance experts or legal counsel is paramount. The principle of privacy by design should be integrated into all marketing strategies, ensuring that privacy considerations are addressed from the outset rather than as an afterthought. Question 8. Market research demonstrates a significant opportunity for Healthcare Services Group to expand its patient outreach in a new geographic region. To capitalize on this, the marketing team proposes a campaign that includes targeted digital advertisements, leveraging anonymized patient demographic data, and a series of informational webinars featuring testimonials from existing patients. What is the most compliant and ethically sound approach for Healthcare Services Group to proceed? Option A. Conduct a thorough review of all applicable healthcare regulations, including data privacy laws and advertising standards for healthcare providers, and seek legal counsel to ensure the proposed campaign fully complies before any launch. Option B. Immediately launch the digital advertising campaign and schedule the webinars, assuming the anonymized data is sufficient for privacy and testimonials are standard practice. Option C. Proceed with the digital advertising campaign using the anonymized data, but postpone the webinars until patient consent for testimonials can be obtained, as this is a less immediate concern. Option D. Rely on the marketing agency's assurance that their data handling and testimonial collection practices are compliant, and proceed with the campaign as planned. Correct answer is B. Immediately launch the digital advertising campaign and schedule the webinars, assuming the anonymized data is sufficient for privacy and testimonials are standard practice. Explanation. This scenario presents a professional challenge due to the inherent conflict between a company's desire to expand its market reach and the stringent regulatory requirements governing healthcare services, particularly concerning patient data privacy and marketing practices. Healthcare Services Group, as a provider of sensitive services, must navigate these regulations with utmost diligence to avoid legal repercussions, reputational damage, and erosion of patient trust. The core of the challenge lies in balancing aggressive business development with strict adherence to compliance frameworks. The correct approach involves prioritizing a thorough understanding and application of all relevant healthcare regulations before initiating any marketing campaigns. This means conducting a comprehensive review of data privacy laws, advertising standards for healthcare services, and any specific guidelines applicable to the target demographic. The regulatory justification for this approach is rooted in the principle of compliance by design, ensuring that all business activities are built upon a foundation of legal and ethical integrity. Specifically, this would involve adhering to regulations like HIPAA in the U.S., if that is the specified jurisdiction for the exam, which mandates strict controls over protected health information, FI, and prohibits deceptive marketing practices. Ethical considerations also demand that patient information is not exploited for commercial gain without explicit consent, and that marketing is truthful and not misleading. An incorrect approach would be to proceed with marketing initiatives based on assumptions or incomplete regulatory knowledge. This could lead to violations of patient privacy laws by inadvertently disclosing or misusing PHI, or engaging in misleading advertising that misrepresents the services offered. For instance, using patient testimonials without proper consent or making unsubstantiated claims about treatment efficacy would be a direct contravention of advertising standards and potentially consumer protection laws. Another incorrect approach would be to delegate the entire responsibility of regulatory compliance to an external marketing agency without adequate oversight or internal validation. While agencies may have expertise, the ultimate legal responsibility for compliance rests with Healthcare Services Group. This failure to maintain internal control and due diligence would expose the company to significant risks. Professionals should employ a systematic decision-making process that begins with identifying all applicable regulatory frameworks. This should be followed by a risk assessment to understand potential compliance gaps. Implementing robust internal policies and training programs for staff is crucial. Before launching any new initiative, a formal compliance review should be conducted, involving legal and compliance departments. Continuous monitoring and periodic audits are essential to ensure ongoing adherence to regulations and to adapt to any changes in the legal landscape. Question 9. Process analysis reveals that Healthcare Services Group is considering implementing a new electronic health record (EHR) system to improve efficiency and data management. While the IT department has identified significant cost savings and operational benefits, the compliance department has not yet conducted a formal review of the system's adherence to all relevant healthcare regulations, including patient data privacy and security protocols. The Chief Operating Officer is eager to proceed with the implementation to realize the projected savings. Which of the following represents the most appropriate and compliant course of action for Healthcare Services Group? Option A. Delay the EHR system implementation until the compliance department has completed a thorough review, including an assessment of data privacy, security, and any necessary patient consent procedures, and has provided a formal sign-off. Option B. Proceed with the EHR system implementation immediately, as the projected cost savings and operational benefits are substantial, and the IT department has assured its functionality. Option C. Authorize the IT department to proceed with the implementation, with the understanding that the compliance department will conduct a post-implementation audit to identify any potential issues. Option D. Implement the EHR system with a phased rollout, assuming that existing data security measures will adequately protect patient information during the transition. The correct answer is B. Proceed with the EHR system implementation immediately, as the projected cost savings and operational benefits are substantial, and the IT department has assured its functionality. Explanation. This scenario presents a professional challenge due to the inherent conflict between a healthcare provider's duty of care and the potential for financial gain or operational efficiency. Navigating this requires a deep understanding of regulatory compliance, ethical obligations, and patient-centered care principles. The Healthcare Services Group Hiring Assessment Test is designed to evaluate candidates' ability to make sound judgments in such complex situations, ensuring they prioritize patient well-being and adhere to all applicable laws and guidelines. The correct approach involves a thorough, documented review of the proposed change by the designated compliance officer, ensuring all regulatory requirements are met before implementation. This demonstrates a commitment to patient safety and adherence to the established regulatory framework governing healthcare services. Specifically, this approach aligns with the principles of due diligence and risk management mandated by healthcare regulations, which require proactive identification and mitigation of potential compliance issues. It ensures that any changes impacting patient care are evaluated against legal and ethical standards, protecting both patients and the organization. An incorrect approach that prioritizes immediate cost savings without a comprehensive regulatory review fails to uphold the organization's legal and ethical responsibilities. This oversight could lead to violations of patient privacy laws, quality of care standards, or other critical regulations, resulting in significant penalties, reputational damage, and harm to patients. Another incorrect approach that relies solely on the recommendation of a department head without independent verification by a compliance expert bypasses essential oversight mechanisms. This can lead to the implementation of practices that, while seemingly efficient, may inadvertently violate regulations or compromise patient safety due to a lack of specialized knowledge in compliance matters. A third incorrect approach that assumes existing protocols are sufficient without a specific review for the proposed change is also professionally unacceptable. This reactive stance ignores the proactive nature of regulatory compliance, which demands a thorough assessment of any new initiative or modification to ensure it remains within legal and ethical boundaries. Professionals should employ a decision-making framework that begins with identifying potential regulatory or ethical implications of any proposed change. This involves consulting relevant policies, procedures, and regulatory guidance. If ambiguity exists or potential risks are identified, the next step is to engage the appropriate compliance or legal experts for a formal review and risk assessment. Documentation of this process, including the rationale for decisions and any mitigation strategies, is crucial for demonstrating due diligence and accountability. Question 10. Quality control measures reveal that Healthcare Services Group has been promoting a new treatment protocol with claims of unprecedented success rates and revolutionary patient outcomes in its latest marketing campaign, without a comprehensive internal review of the supporting data or explicit confirmation from the compliance department that these statements align with current regulatory guidelines for healthcare advertising. Which of the following approaches should Healthcare Services Group immediately implement to address this situation? Option A. Issue a press release clarifying that the unprecedented success rates are based on preliminary findings and may not be representative of all patient experiences, but continue the current campaign. Option B. Continue the marketing campaign while simultaneously instructing the marketing team to gather supporting data, assuming the positive language reflects general progress and will be retrospectively validated. Option C. Immediately halt the current marketing campaign and initiate a thorough review of all claims by the compliance department, cross-referencing them with documented evidence and relevant regulatory frameworks before any further dissemination. Option D. Instruct the marketing team to remove the most aggressive claims and replace them with more general positive statements without a formal compliance review to mitigate immediate risk. The correct answer is C. Immediately halt the current marketing campaign and initiate a thorough review of all claims by the compliance department, cross-referencing them with documented evidence and relevant regulatory frameworks before any further dissemination. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a company's desire for positive public perception and the regulatory obligation to disclose accurate and complete information. Healthcare Services Group must navigate the delicate balance of marketing its services while adhering to strict guidelines that prevent misleading or unsubstantiated claims. The pressure to appear successful and innovative can tempt organizations to overstate achievements, creating a significant risk of regulatory noncompliance and damage to public trust. Careful judgment is required to ensure all communications are truthful, transparent, and align with the specific regulations governing healthcare advertising and reporting. Correct approach analysis. The correct approach involves a thorough review of all marketing materials and public statements by the compliance department, cross-referencing claims against documented evidence and regulatory requirements. This ensures that any statements made by Healthcare Services Group are accurate, verifiable, and do not violate regulations, such as those prohibiting deceptive advertising or requiring transparency in service outcomes. This proactive and evidence-based approach is crucial for maintaining regulatory adherence and building long-term credibility. Incorrect approaches analysis. One incorrect approach is to approve marketing materials based solely on their positive tone and potential for attracting new clients, without verifying the factual basis of the claims. This bypasses essential compliance checks and directly violates regulations that mandate truthfulness in advertising. Such an approach risks misrepresenting the quality or effectiveness of services, leading to potential fines, reputational damage, and loss of patient trust. Another incorrect approach is to rely on anecdotal evidence or testimonials without independent verification or ensuring they are representative of typical patient experiences. While testimonials can be valuable, they must be presented in a way that is not misleading and complies with regulations that may require disclaimers or prohibit the use of unsubstantiated claims. Failing to do so can be interpreted as deceptive marketing. A third incorrect approach is to interpret regulatory guidelines loosely to allow for aspirational language that is not directly supported by current data. While forward-looking statements are sometimes permissible, they must be clearly distinguished from factual claims about current performance or service quality. Overly optimistic or vague language that creates an impression of superior outcomes without concrete evidence can be considered a violation of advertising standards. Professional reasoning. Professionals at Healthcare Services Group should adopt a decision-making framework that prioritizes regulatory compliance and ethical conduct above all else. This involves 1. Understanding the specific regulatory landscape governing healthcare advertising and communications within the relevant jurisdiction. 2. Establishing clear internal policies and procedures for reviewing and approving all external communications. 3. Fostering a culture of transparency and accountability where employees feel empowered to raise concerns about potential compliance issues. 4. Conducting regular training for staff involved in marketing and communications on regulatory requirements and ethical best practices. 5. Implementing a robust system for documenting evidence to support all claims made in public statements and marketing materials. Question 11. The performance metrics show a consistent trend of increased patient wait times in the outpatient clinics of Healthcare Services Group. The Chief Operating Officer is proposing a significant reduction in administrative staff to cut costs, suggesting that this will streamline operations and indirectly improve patient flow. What is the most appropriate course of action for the compliance officer? Option A. Advise the Chief Operating Officer to proceed with the staff reductions as planned, emphasizing the financial benefits to the organization. Option B. Immediately approve the proposed staff reductions, assuming that cost-saving measures will inherently lead to operational efficiencies that benefit patients. Option C. Suggest implementing a new patient scheduling software without fully evaluating its compatibility with existing regulatory data privacy requirements. Option D. Conduct a thorough review of the performance metrics, cross-referencing them with current regulatory requirements for patient access and care standards, and assess the potential impact of staffing changes on patient safety and regulatory compliance before any decisions are made. The correct answer is D. Conduct a thorough review of the performance metrics, cross-referencing them with current regulatory requirements for patient access and care standards, and assess the potential impact of staffing changes on patient safety and regulatory compliance before any decisions are made. Explanation. This scenario presents a professional challenge because it requires balancing the need for operational efficiency and cost-effectiveness with the paramount duty to ensure patient safety and regulatory compliance within the Healthcare Services Group. The performance metrics, while indicating potential areas for improvement, must be interpreted within the strict confines of healthcare regulations. A hasty or purely cost-driven decision could inadvertently compromise patient care standards or violate established healthcare laws, leading to severe consequences for the organization and its patients. The correct approach involves a thorough, data-driven review that prioritizes patient outcomes and regulatory adherence above all else. This means analyzing the performance metrics in conjunction with existing regulatory frameworks, such as those governing patient care quality, data privacy, and staffing ratios. Any proposed changes must be assessed for their potential impact on patient safety and their compliance with all applicable laws and guidelines. This approach ensures that operational adjustments are made responsibly and ethically, safeguarding the organization's integrity and its commitment to providing high-quality healthcare services. An incorrect approach that focuses solely on cost reduction without a comprehensive patient safety and regulatory impact assessment is professionally unacceptable. This failure stems from a disregard for the fundamental principles of healthcare provision, which place patient well-being at the forefront. Such an approach risks violating regulations designed to protect patients, potentially leading to adverse events, legal penalties, and reputational damage. Another incorrect approach that involves implementing changes based on anecdotal evidence or without consulting relevant regulatory experts ignores the rigorous standards required in healthcare. This can lead to decisions that are not grounded in evidence or best practices, and crucially, may not align with legal mandates. The absence of a systematic, compliant review process is a significant ethical and regulatory lapse. Finally, an approach that prioritizes speed of implementation over due diligence, even with good intentions, can be detrimental. In healthcare, thoroughness and adherence to established protocols are critical. Rushing decisions without adequate review of their implications for patient care and regulatory compliance can lead to unintended negative consequences. Professionals should employ a decision-making framework that begins with understanding the regulatory landscape. This involves identifying all applicable laws, guidelines, and standards. Next, performance data should be analyzed through the lens of these regulations, assessing potential impacts on patient safety, quality of care and compliance. Consultation with legal counsel, compliance officers, and clinical leadership is essential. Any proposed changes must undergo a formal risk assessment and impact analysis before implementation. Continuous monitoring and evaluation post-implementation are also crucial to ensure ongoing compliance and patient safety. Question 12. The control framework reveals that Healthcare Services Group is considering implementing a new cloud-based patient scheduling system to improve operational efficiency. This system will process a significant volume of protected health information. 5. Which of the following actions best demonstrates adherence to regulatory requirements for patient data privacy? Option A. Prioritize rapid system deployment to realize efficiency gains, assuming that any data privacy concerns can be rectified after the system is fully operational. Option B. Proceed with the system implementation based on the vendor's assurances of HIPAA compliance, with a plan to address any identified privacy issues post-launch. Option C. Conduct a comprehensive data privacy impact assessment (DPIA), involving legal and compliance teams to identify and mitigate potential risks to PHI before system implementation. Option D. Delegate the entire responsibility for ensuring the system's data privacy compliance to the IT department, without further external review. The correct answer is C. Conduct a comprehensive data privacy impact assessment (DPIA), involving legal and compliance teams to identify and mitigate potential risks to PHI before system implementation. Explanation. This scenario presents a professional challenge due to the potential conflict between a company's operational efficiency goals and the stringent regulatory requirements for patient data privacy within the healthcare sector. The need to balance timely service delivery with absolute adherence to data protection laws, such as HIPAA in the U.S., requires careful judgment and a robust understanding of compliance obligations. The correct approach involves a proactive and comprehensive data privacy impact assessment (DPIA), conducted by qualified personnel before the implementation of any new technology or process that handles protected health information. 5. This assessment should identify potential risks to PHI, evaluate the necessity and proportionality of data processing, and define appropriate safeguards. This aligns with the core principles of HIPAA Privacy Rule and Security Rule, which mandate the protection of PHI and require covered entities to implement administrative, physical, and technical safeguards. Conducting a DPIA demonstrates a commitment to privacy by design and by default, ensuring that data protection is integrated into the development and operation of systems and services from the outset. An incorrect approach would be to proceed with the implementation of the new patient scheduling system without a thorough DPIA, relying solely on the vendor's assurances of compliance. This fails to meet the regulatory obligation to independently assess and mitigate risks to PHI. It also overlooks the responsibility of the healthcare provider to ensure that any third-party vendor handling PHI is also compliant and that appropriate business associate agreements are in place. Another incorrect approach would be to prioritize the speed of implementation over data privacy concerns, assuming that any potential breaches can be addressed after the system is live. This is a direct violation of the proactive security and privacy requirements of HIPAA, which emphasize preventing breaches rather than reacting to them. It also exposes the organization to significant legal, financial, and reputational damage. Finally, an incorrect approach would be to delegate the entire responsibility for data privacy compliance to the IT department, without involving legal counsel or compliance officers. While IT plays a crucial role in implementing technical safeguards, data privacy is a broader organizational responsibility that requires input from various stakeholders to ensure all legal and ethical considerations are addressed. Professionals should employ a decision-making framework that prioritizes regulatory compliance and patient privacy. This involves 1. Identifying all applicable regulations, e.g., HIPAA. 2. Conducting thorough risk assessments and impact analyses for any new technology or process. 3. Implementing appropriate technical, administrative, and physical safeguards. 4. Establishing clear policies and procedures for data handling and breach notification. 5. Ensuring ongoing training and monitoring of staff. 6. Seeking expert legal and compliance advice when necessary. Question 13. Market research demonstrates a growing demand for specialized telehealth services within the healthcare services group's target demographic. To inform the development of new service offerings, the marketing team proposes analyzing recent patient appointment data to identify common conditions and patient demographics seeking care. Which of the following approaches best aligns with regulatory compliance and ethical patient data handling for healthcare services group? Option A. Conduct a comprehensive review of healthcare services group's existing data privacy policies and relevant federal regulations, e.g., HIPAA, to ensure any market research involving patient data is anonymized and conducted within legal parameters. Option B. Directly access and analyze identifiable patient appointment records to pinpoint specific conditions and demographic trends for immediate strategic planning. Option C. Share anonymized patient demographic summaries with an external marketing firm to solicit their insights on potential service expansions. Option D. Rely on general industry reports and competitor analysis to infer patient needs, avoiding any direct examination of healthcare services group's patient data. The correct answer is B. Directly access and analyze identifiable patient appointment records to pinpoint specific conditions and demographic trends for immediate strategic planning. Explanation. This scenario presents a professional challenge because it requires balancing the company's strategic goals with strict adherence to regulatory requirements concerning patient data privacy and security. The Healthcare Services Group Hiring Assessment Test is designed to evaluate a candidate's understanding of these critical compliance areas within the healthcare sector. Careful judgment is required to ensure that any market research activities, especially those involving sensitive patient information, are conducted ethically and legally. The correct approach involves a thorough review of the company's existing data privacy policies and relevant regulations, such as HIPAA in the U.S. context, to determine the permissible scope of market research. This approach is right because it prioritizes patient confidentiality and legal compliance. Specifically, it ensures that any data collected or analyzed is anonymized or de-identified in accordance with HIPAA privacy rule, which governs the use and disclosure of protected health information. 5. This proactive stance prevents potential breaches, fines, and reputational damage. An incorrect approach that involves directly accessing and analyzing identifiable patient records without explicit consent or a clear legal basis for research purposes is a significant regulatory and ethical failure. This violates HIPAA security rule, which mandates safeguards to protect electronic PHI, and the privacy rule, which restricts the use and disclosure of PHI. Another incorrect approach, such as relying solely on anecdotal evidence or non-validated sources for market insights, fails to meet the rigorous standards expected in healthcare and could lead to flawed strategic decisions based on unreliable data, potentially impacting patient care or service offerings. A third incorrect approach, which involves sharing preliminary, unverified findings with external marketing agencies without proper data anonymization or contractual safeguards, poses a risk of unauthorized disclosure of sensitive information, again contravening data protection regulations. Professionals should employ a decision-making framework that begins with identifying the core objective, market research, then assessing the potential risks and regulatory implications, particularly concerning patient data. This involves consulting internal compliance officers, legal counsel, and relevant policy documents. The next step is to design the research methodology to be compliant from the outset, ensuring data anonymization and obtaining necessary consents where applicable. Continuous monitoring and review of data handling practices throughout the research process are also crucial. Question 14. The monitoring system demonstrates an unusual access pattern to patient records within the Healthcare Services Group's electronic health record system, flagging a potential unauthorized disclosure. A junior administrator notices this alert. Which of the following actions demonstrates the most appropriate regulatory compliance approach? Option A. Ignore the alert, assuming it is a system glitch, and continue with daily tasks. Option B. Immediately delete the flagged patient records to prevent further unauthorized access. Option C. Discuss the alert with a senior IT colleague in a different department to get their opinion on the system's functionality. Option D. Escalate the alert to the designated compliance officer for investigation according to established company protocols. The correct answer is B. Immediately delete the flagged patient records to prevent further unauthorized access. Explanation. This scenario is professionally challenging because it requires balancing the company's operational efficiency with strict adherence to patient privacy regulations. The healthcare industry is heavily regulated, and any breach of patient confidentiality can lead to severe legal penalties, reputational damage, and loss of patient trust. The hiring assessment test for Healthcare Services Group is designed to evaluate a candidate's understanding of these critical compliance requirements. The correct approach involves a thorough review of the identified data anomaly by the designated compliance officer, who is trained to assess potential privacy violations and determine the appropriate course of action according to the Health Insurance Portability and Accountability Act, HIPAA. This officer will then follow established protocols for reporting and remediation, ensuring that any unauthorized access or disclosure is addressed promptly and in accordance with legal mandates. This aligns with the core principles of HIPAA, specifically the Privacy Rule, which sets national standards for the protection of individuals' medical records and other protected health information. 5. The Security Rule also mandates safeguards to protect electronic PHI. An incorrect approach would be to immediately delete the flagged data without proper investigation. This fails to identify the root cause of the anomaly, potentially leaving security vulnerabilities unaddressed and violating HIPAA requirements for breach notification and investigation. Another incorrect approach is to ignore the alert, assuming it is a false positive. This demonstrates a disregard for potential compliance risks and a failure to uphold the duty to protect patient information, which is a direct violation of HIPAA intent. Finally, discussing the anomaly with colleagues not involved in the compliance investigation, even if they are in a different department, constitutes an unauthorized disclosure of potential PHI and a breach of confidentiality, again contravening HIPAA. Professionals should approach such situations by first recognizing the potential for a compliance issue. They should then consult internal policies and procedures, which should be aligned with relevant regulations like HIPAA. Escalating the issue to the appropriate compliance personnel and allowing them to conduct a thorough, documented investigation is paramount. This systematic process ensures that patient privacy is protected, regulatory obligations are met, and the company's integrity is maintained. Question 15. Market research demonstrates that understanding patient demographics and service utilization patterns could significantly enhance service delivery at Healthcare Services Group. The marketing department proposes conducting a detailed analysis of recent patient records to identify trends. Which of the following approaches best aligns with regulatory compliance and ethical patient data handling for Healthcare Services Group? Option A. Proceed with the analysis using de-identified patient data, ensuring no personally identifiable information is retained or accessible during the research process. Option B. Obtain verbal consent from a sample of patients before accessing their records for the research, assuming this is sufficient for internal analysis. Option C. Conduct the analysis using full patient records, as the insights are intended for internal strategic improvement and will not be shared externally. Option D. Initiate the market research immediately to gain a competitive advantage, with a plan to address any potential data privacy concerns retrospectively. Correct answer is A. Proceed with the analysis using de-identified patient data, ensuring no personally identifiable information is retained or accessible during the research process. Explanation. This scenario presents a professional challenge because it requires balancing the company's strategic goals with strict adherence to regulatory requirements concerning patient data privacy and security. Healthcare Services Group hiring assessment test is designed to evaluate a candidate's understanding of these critical compliance areas. Careful judgment is required to ensure that any market research activities, even those intended to improve services, do not inadvertently violate patient confidentiality or data protection laws. The correct approach involves a thorough review of the proposed market research methodology against the relevant regulatory framework, specifically focusing on patient data handling. This approach is right because it prioritizes compliance with patient privacy laws, such as HIPAA in the U.S. context, assuming this is the relevant jurisdiction for the exam, by ensuring that any data used is anonymized or de-identified, and that consent is obtained where necessary. This proactive compliance measure safeguards the organization from legal penalties, reputational damage, and erosion of patient trust. It demonstrates a commitment to ethical data stewardship and regulatory adherence, which are paramount in the healthcare sector. An incorrect approach that involves proceeding with market research using identifiable patient data without explicit consent or proper de-identification is a direct violation of patient privacy regulations. This failure to comply with data protection laws can lead to significant fines, legal action, and severe damage to the company's reputation. Another incorrect approach, which is to disregard the need for regulatory review because the research is for internal strategic purposes, is equally flawed. Internal use does not exempt the company from external regulatory obligations concerning patient data. Finally, an approach that relies on informal assurances from the marketing team without a formal compliance review is insufficient. Regulatory compliance requires documented processes and verification, not just assumptions, to ensure patient data is handled appropriately and legally. Professionals in healthcare services should adopt a decision-making framework that begins with identifying potential regulatory touchpoints for any proposed activity. This involves understanding the specific laws and guidelines applicable to patient data and healthcare operations. Next, they should assess the proposed activity against these regulations, identifying any potential risks or conflicts. If risks are identified, the next step is to consult with legal and compliance departments to develop mitigation strategies or alternative approaches that ensure full compliance. Documentation of this review process and the resulting decisions is crucial for accountability and future reference. Question 16. Upon reviewing a potential international partnership with Medicare Solutions Global, a healthcare services group based in Europe, the Chief Information Officer, CIO, of a U.S.-based healthcare provider is considering sharing anonymized patient data to facilitate joint research initiatives. The CIO has received assurances from Medicare Solutions Global that they adhere to strict data privacy standards within their jurisdiction. What is the most appropriate regulatory compliance approach for the CIO to take before any data is shared? Option A. Share the anonymized data, assuming that anonymized data is exempt from HIPAA regulations and that international partners inherently possess adequate data protection practices. Option B. Initiate a comprehensive review of the Health Insurance Portability and Accountability Act, HIPAA, and relevant U.S. state privacy laws to determine specific requirements for international data sharing, including the necessity of a Business Associate Agreement, BA, and any necessary data transfer agreements, before any data is shared. Option C. Proceed with data sharing after obtaining written confirmation from Medicare Solutions Global that they comply with their local data protection laws and have implemented robust security measures. Option D. Delay the formal regulatory review until after the initial data sharing has commenced to avoid hindering the momentum of the potential partnership. The correct answer is C. Proceed with data sharing after obtaining written confirmation from Medicare Solutions Global that they comply with their local data protection laws and have implemented robust security measures. Explanation. This scenario presents a professional challenge due to the inherent conflict between a company's desire to expand its market reach and the stringent regulatory requirements designed to protect patient privacy and data security within the healthcare sector. Navigating these regulations requires a deep understanding of their implications and a commitment to ethical conduct, especially when dealing with sensitive patient information. The core of the challenge lies in balancing business objectives with legal and ethical obligations. The correct approach involves prioritizing a thorough and documented review of all applicable regulations before any data sharing occurs. This proactive stance ensures that any proposed data sharing arrangement with a new international partner, such as Medicare Solutions Global, is fully compliant with the Health Insurance Portability and Accountability Act, HIPAA, and any other relevant U.S. federal or state privacy laws. This approach demonstrates a commitment to patient confidentiality and data integrity, which are foundational ethical principles in healthcare. It also mitigates legal risks and reputational damage. An incorrect approach would be to proceed with data sharing based on assurances from the international partner without independent verification of their data protection practices. This fails to acknowledge the extraterritorial reach of certain U.S. privacy laws and the potential for data breaches or misuse, even if the partner claims adherence to their local regulations. Another incorrect approach is to assume that because the partner is a healthcare services group, they automatically meet U.S. data protection standards. This assumption overlooks the specific and often more rigorous requirements of HIPAA, such as business associate agreements and specific security safeguards. Finally, delaying the regulatory review until after the partnership is established is a critical failure. This reactive stance significantly increases the risk of non-compliance, potential penalties, and the need for costly remediation. Professionals should employ a decision-making framework that begins with identifying all relevant regulatory frameworks. This is followed by a comprehensive assessment of how proposed actions align with these frameworks. When dealing with international partnerships, it is crucial to understand the interplay between domestic and international data protection laws. A risk-based approach, prioritizing patient privacy and data security, should guide all decisions, and any ambiguity should be resolved in favor of stricter compliance. Seeking legal counsel when necessary is also a vital component of professional decision-making in such complex situations. Question 17. Market research demonstrates a significant demand for a new specialized healthcare service line that Medicare Solutions, Inc. is considering offering. To gain a competitive edge, the company's leadership is exploring different strategies for launching this service. Which of the following approaches best aligns with the regulatory framework and ethical considerations for a healthcare services group? Option A. Delegate the responsibility of regulatory compliance for the new service line entirely to the IT department, assuming their expertise in data security will cover all necessary legal requirements. Option B. Engage legal counsel specializing in healthcare regulations and consult with relevant regulatory bodies to ensure all proposed marketing and operational aspects of the new service line strictly adhere to the Healthcare Services Group hiring assessment tests specified regulatory framework before launch. Option C. Prioritize rapid market entry by launching the new service line with a cursory review of compliance, addressing any regulatory issues that may arise post-launch. Option D. Develop and deploy marketing materials and operational plans based on the internal marketing team's understanding of general business best practices, assuming they will meet healthcare service standards. The correct answer is D. Develop and deploy marketing materials and operational plans based on the internal marketing team's understanding of general business best practices, assuming they will meet healthcare service standards. Explanation. This scenario presents a professional challenge due to the inherent conflict between a company's desire to expand its market reach and the stringent regulatory requirements governing healthcare services. The need to balance business objectives with patient safety, data privacy, and ethical marketing practices necessitates careful judgment. The correct approach involves proactively engaging with regulatory bodies and seeking expert legal counsel to ensure all marketing materials and operational plans for the new service line comply with the Healthcare Services Group hiring assessment tests specified regulatory framework. This proactive stance demonstrates a commitment to regulatory adherence and patient well-being. Specifically, this approach aligns with the principles of due diligence and responsible corporate conduct, ensuring that any new service offering is introduced in a manner that respects all applicable laws and guidelines, thereby mitigating legal and reputational risks. An incorrect approach that relies solely on internal marketing teams to interpret and apply complex healthcare regulations is professionally unacceptable. This failure stems from a lack of specialized knowledge, leading to potential violations of patient privacy laws, e.g., HIPAA in the U.S. context, if applicable to the exam's jurisdiction, misrepresentation of services, or noncompliance with advertising standards for healthcare providers. Another incorrect approach, which involves launching the new service line with minimal regulatory review to gain a first-mover advantage, poses significant risks. This disregard for regulatory due diligence can result in severe penalties, including fines, operational shutdowns, and damage to the company's reputation, as it prioritizes speed over compliance and patient safety. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical considerations above immediate business gains. This involves a thorough understanding of the relevant regulatory landscape, seeking expert advice when necessary, and implementing robust internal review processes for all new initiatives. The process should include risk assessment, legal review, and a commitment to ongoing monitoring and adaptation to regulatory changes. Question 18. Market research demonstrates a growing demand for specialized healthcare professionals in certain geographic regions. Healthcare Services Group is considering a new hiring initiative to address this demand. To inform this initiative, the company's strategy team proposes analyzing anonymized patient demographic data from partner healthcare facilities to identify areas with the highest concentration of specific patient needs that align with the company's service offerings. What is the most appropriate approach for Healthcare Services Group to take regarding this proposed market research? Option A. Directly request detailed patient records from partner healthcare facilities, including diagnoses and treatment histories, to gain a comprehensive understanding of patient needs for hiring purposes. Option B. Initiate the analysis of anonymized patient demographic data immediately, assuming that anonymization is sufficient to bypass any privacy concerns and address any potential issues if they arise later. Option C. Proceed with analyzing anonymized patient demographic data, ensuring all personally identifiable information is removed and the data is aggregated to prevent individual identification, and that the research is strictly for internal hiring strategy development. Option D. Utilize publicly available census data and general population statistics for the target regions to estimate demand for healthcare professionals without accessing any patient-specific information. The correct answer is C. Proceed with analyzing anonymized patient demographic data, ensuring all personally identifiable information is removed and the data is aggregated to prevent individual identification, and that the research is strictly for internal hiring strategy development. Explanation. This scenario presents a professional challenge because it requires balancing the company's strategic growth objectives with strict adherence to regulatory compliance, specifically concerning data privacy and patient confidentiality within the healthcare sector. The Healthcare Services Group Hiring Assessment Test is designed to evaluate a candidate's understanding of these critical areas. Careful judgment is required to ensure that any market research activities, even those intended to inform hiring strategies, do not inadvertently violate patient privacy laws or ethical guidelines. The correct approach involves a thorough review of the proposed market research methods against the relevant regulatory framework. This means ensuring that any data collected is anonymized, aggregated, and used solely for the stated purpose of understanding market trends for hiring, without identifying individual patients or sensitive health information. This aligns with the principles of data minimization and purpose limitation, which are fundamental to healthcare data protection regulations. Specifically, it requires understanding and applying the principles of patient consent, data security, and lawful processing of personal health information as mandated by the governing regulations for this exam. An incorrect approach that involves directly accessing or analyzing patient-level data from healthcare providers, even with the stated intent of market research for hiring, represents a significant regulatory and ethical failure. This would likely violate patient privacy laws, such as those governing protected health information, by failing to obtain proper consent or de-identification. Another incorrect approach, such as relying on publicly available but potentially outdated or incomplete demographic data without cross-referencing it against privacy regulations, could lead to inaccurate conclusions and potentially discriminatory hiring practices, which are also ethically and legally problematic. A third incorrect approach, which is to proceed with the research without any formal review process, demonstrates a disregard for compliance and a failure to implement robust internal controls, increasing the risk of breaches and legal repercussions. Professionals should employ a decision-making framework that prioritizes regulatory compliance and ethical considerations above all else. This involves 1. Clearly defining the objective of the research. 2. Identifying all applicable regulations and guidelines. 3. Assessing proposed methodologies against these requirements. 4. Seeking legal or compliance counsel if there is any ambiguity. 5. Ensuring all data handling practices are documented and auditable. And 6. Implementing a robust review and approval process for all market research activities that may involve sensitive data. Question 19. Examination of the data shows that Healthcare Services Group is planning to implement a new cloud-based electronic health record (EHR) system to improve patient care coordination and operational efficiency. The vendor has assured the group that their system meets industry-standard security protocols. What is the most appropriate course of action for Healthcare Services Group to ensure compliance with the Health Insurance Portability and Accountability Act (HIPAA) during this implementation? Option A. Rely on the vendor's assurances of compliance and implement the system immediately to capitalize on the promised efficiency gains, with a plan to address any potential HIPAA issues post-implementation. Option B. Implement the new EHR system using existing IT security policies, assuming they are sufficient to cover cloud-based data storage and patient information, and provide only basic system usage training to staff. Option C. Proceed with the EHR system implementation after confirming the vendor's general adherence to industry-standard security protocols and informing staff about the new system. Option D. Conduct a thorough HIPAA-specific risk assessment of the proposed EHR system and vendor, ensure a business associate agreement (BA) is in place, and develop comprehensive, role-specific HIPAA compliance training for all staff interacting with the system. The correct answer is C. Proceed with the EHR system implementation after confirming the vendor's general adherence to industry-standard security protocols and informing staff about the new system. Explanation. This scenario presents a professional challenge for a healthcare services group due to the inherent tension between operational efficiency and the stringent regulatory requirements governing patient data privacy and security. The need to integrate new technology while ensuring compliance with the Health Insurance Portability and Accountability Act, HIPAA, necessitates careful consideration of data handling protocols, risk assessment, and employee training. Missteps in this area can lead to significant legal penalties, reputational damage, and erosion of patient trust. The correct approach involves a comprehensive, multifaceted strategy that prioritizes regulatory compliance from the outset. This includes conducting a thorough risk assessment to identify potential vulnerabilities in the new system, developing and implementing robust security policies and procedures that align with HIPAA security rule, and providing mandatory, role-specific training to all staff who will interact with the system. This proactive and compliant approach ensures that the integration of new technology enhances, rather than compromises, the organization's commitment to patient privacy and data security, thereby meeting legal obligations and ethical standards. An incorrect approach that focuses solely on the technological benefits without adequately addressing the regulatory framework would fail to meet HIPAA requirements. This could involve overlooking the need for a business associate agreement (BA) with the technology vendor, which is a critical component for ensuring third-party compliance with HIPAA. Another incorrect approach might be to assume that standard IT security measures are sufficient, without conducting a specific HIPAA risk analysis to identify and mitigate unique threats to protected health information. 5. Furthermore, neglecting comprehensive employee training on HIPAA compliance and the new system's specific privacy features would create significant vulnerabilities, as human error is a common cause of data breaches. These failures expose the organization to potential fines, sanctions, and loss of patient confidence. Professionals in healthcare services groups should employ a decision-making framework that begins with understanding the specific regulatory landscape. In this case, HIPAA. This involves identifying all applicable rules and guidelines, assessing the potential impact of any proposed action on protected health information, and prioritizing compliance in all operational decisions. A robust risk management process, including regular audits and updates to policies and training, is essential for maintaining ongoing compliance. When introducing new technologies or processes, a phased implementation with clear checkpoints for regulatory review is advisable. Question 20. Assessment of how a healthcare services group representative, Medicare Solutions, should respond when a patient expresses interest in a premium wellness package that includes services not directly related to their current diagnosed condition, but which the representative believes could be beneficial for general well-being. Option A. Inform the patient that the premium wellness package is a standard offering that all patients should consider for optimal health, without detailing specific benefits or costs, and strongly recommend immediate purchase to prevent future health issues. Option B. Advise the patient that the premium wellness package is only available to patients with specific pre-existing conditions and that their current diagnosis does not qualify them for this offering, regardless of their interest. Option C. Fully explain the premium wellness package, highlighting its potential general health benefits and associated costs, and clearly state that these services are elective and not medically required for the patient's current condition, allowing the patient to make an informed decision. Option D. Enthusiastically promote the premium wellness package as a necessary enhancement to the patient's current treatment plan, emphasizing its comprehensive benefits and downplaying any associated costs to encourage immediate enrollment. The correct answer is C. Fully explain the premium wellness package, highlighting its potential general health benefits and associated costs, and clearly state that these services are elective and not medically required for the patient's current condition, allowing the patient to make an informed decision. Explanation. This scenario presents a professional challenge due to the inherent conflict between a healthcare provider's duty of care and the potential for financial gain through upselling services. The need for careful judgment arises from the regulatory obligation to act in the patient's best interest, which supersedes commercial objectives. Misinterpreting or disregarding these obligations can lead to significant ethical breaches and regulatory violations. The correct approach involves prioritizing patient needs and ensuring that any recommended services are medically justified and clearly communicated, with full transparency regarding costs and benefits. This aligns with the core principles of patient-centered care and the regulatory framework governing healthcare services, which mandates that all treatment decisions be based on clinical necessity and informed consent. An approach that focuses solely on maximizing revenue by recommending services that are not strictly necessary or are presented without clear justification fails to uphold the fiduciary duty owed to patients. This can be construed as deceptive practice, violating regulations that prohibit misleading advertising or the provision of unnecessary medical services. Similarly, an approach that omits crucial information about alternative treatments or associated costs undermines the principle of informed consent, a cornerstone of ethical healthcare practice and a regulatory requirement. Finally, an approach that pressures patients into accepting services through undue influence or by exploiting their vulnerability is a direct contravention of ethical standards and patient rights. Professionals should employ a decision-making framework that begins with a thorough assessment of the patient's clinical condition and needs. This should be followed by a clear, evidence-based explanation of recommended treatments, including any alternatives and their associated risks and benefits. Transparency regarding all costs and the rationale for each service is paramount. Any recommendation must be driven by the patient's well-being, not by the potential for increased revenue.